Across the country, though, others question the value of public health orders and question the value of us being able to clearly outline what needed to happen to protect our residents. In fact, we often heard, if folks don't want to wear a mask, that's okay. Let's not make everyone do it. And that's been the refrain from some politicians for several months now. That approach has been a failure. As we look across the country, we see the COVID-19 infections growing at exponential rates. And here in St. Louis County, we've started to see infections tick up some as well. Our hospitals are filling up, and families are mourning the loss of their loved ones. The COVID-19 pandemic has already cost the lives of 870 St. Louis County residents. 30,000 residents have been infected, and many more have had to go through isolation and quarantine for prolonged periods of time. Infections span the county. No zip code has been unaffected. Our African American, Hispanic, and historically underserved residents have really been impacted disproportionately. And with growing numbers across the state and across the country, St. Louis County cannot give up in its fight against COVID-19. But giving up is exactly what Bills 222 and 223 are asking St. Louis County to do. Put simply, the legal effect of these bills is to end key public health protections to limit the spread of COVID-19 in our community. And these protections have put St. Louis County in a much better place than the rest of the country. Despite the grave results of 222 and 223, the council majority that passed the bill never stopped to ask exactly what the public health orders that would do that they were trying to terminate. But it's vitally important to understand exactly what these bills are trying to do. The council's vote tries to put an end to 5 public health orders. By the actions of the county council, these are the things that the Department of Public Health would no longer be able to do. They would no longer have the ability to define when a positive case or suspected positive case should be quarantined or should be isolated, or others who are exposed should be quarantined. They would end the ability of the Department of Public Health to require masks. They would end the ability to set capacity limits at 50% or limit gatherings, which are currently limited to 50. They would limit the Department of Public Health's ability to require nursing homes to report positive cases or deaths in nursing homes. And they would end the ability or the requirement that all positive tests, negative tests, and deaths are immediately reported to the Department of Public Health. These are common sense, elementary public health rules. They set the basis for isolation and quarantine. They ensure that we can provide the public with the most accurate, up-to-date information to help people understand the data behind how we are making our decisions. They protect our grandparents, they protect our children in schools, and they protect our frontline workers. But without even knowing what orders were being terminated, the council majority tried to wrest control of crafting public health orders from public health officials and take it for themselves, where the lives of those who are struggling with COVID-19 could be tossed around like a political football. But public health decisions should be made by public health experts. They shouldn't be political. Taking steps to protect human life during a pandemic shouldn't be political. Designing protections to make sure that our economy can rebound after a pandemic shouldn't be political. In addition to thousands of residents who have voiced their concerns about these bills and expressed their opposition, organizations representing frontline workers, the medical community, and others have expressed opposition to lifting these public health orders. This includes Local 655, the United Food and Commercial Workers, who work in our grocery stores, the Missouri chapter of the National Education Association representing our teachers, the Missouri State Medical Association representing Missouri doctors, the AARP of Missouri, the Metropolitan Congregations United for St. Louis, the Missionary Baptist State Convention of Missouri, the St. Louis County NAACP, and the St. Louis County Labor Council. Thank you to all of these organizations and others for stepping up to express their concerns for Bills 222 and 223 to end the Public Health Department's ability to issue public health orders. Representatives of some of these organizations are here today to tell you and share with you some of their concerns. Would you like to come forward?
Good morning. My name is Lamia Sorrell, and I have been an employee at SNCS for over 3 years. Since the COVID pandemic began, I have been an essential worker serving my community on the front lines. Workers like me benefit from public health orders like the mask mandate. These orders keep workers and our community safe. County Council Bills 220, 222, and 223 could put those public health orders at risk. Public health orders should not be subjected to political fights. We should trust experts above all else when dealing with a health crisis. I want to thank the St. Louis County Council Public Health Department for what they have done to protect workers like myself. I want to thank County Executive Dr. Sam Page for standing against these bills, and I would like to thank the other elected officials who have fought to protect the public health. I would urge all elected officials to allow the experts to guide us during this pandemic and keep politics out of these serious matters. Thank you all for your time.
Thank you.
Thanks.
Bishop?
God bless you. This is Bishop Elijah Hankerson, President of the St. Louis Metropolitan Clergy Coalition. Standing with me is Reverend Chuck Norris, who serves as the first Vice President of the coalition as well. I tender greetings to each and every one of you on behalf of the St. Louis Metropolitan Clergy Coalition, which is the oldest and largest minority clergy association in the city of St. Louis. This year we celebrate 33 years of service, and we represent over 150 congregations. In the Church of God in Christ, which is the largest Black Pentecostal denomination in America, I serve as a jurisdictional bishop overseeing 60 congregations in the area. Both groups are comprised of thousands of congregants, of whom we tend to the spiritual needs. However, we are also concerned with the health and safety of such a vast number of people. As people of faith, it was our prayer that the St. Louis County Council would have done the right thing by placing the safety of our citizens above politics and vote down Bills 222 and 223. Since that was not the case, here we are today to stand in unity with our St. Louis County Executive, Dr. Sam Page, commending him for today vetoing the decision of the council. I would like to say to the public that this virus is not a hoax. Our beloved former first vice president of the St. Louis Metropolitan Clergy Coalition, the Reverend Carl Smith, also a colleague of mine in the Church of God in Christ, my own uncle, all of these individuals have passed away from the coronavirus. My father was recently at the point of death with the coronavirus, but thank God that he has survived. Numbers are rising, but the St. Louis County has fared better than other areas of the state of Missouri in managing this pandemic. The mask mandates and other public health orders have helped. Although the orders may not be as comfortable as we would desire for them to be, they are for our health and for our safety. Therefore, let all of us unite and trust God and heed the advice of the health officials and the orders that will save our lives. We say follow the rules and obey the laws. Well, let us not try to change what is inconvenient for us. One day soon, we will put all of this behind us, and we'll be able to share the phrase, which is the theme of my life. Every time I turn around, God is blessing me. God bless you.
Good morning. My name is John Bowman, President of St. Louis County NAACP. It is always very challenging to come and speak behind a minister. But that being said, it is very important that we recognize this is not the time to take steps backwards. Mid-Missouri, the numbers are spiking. We are finding that COVID-19 is not going away if we do not follow the guidelines of public health officials. In order to mitigate the transmission of COVID-19, I want to say thank you to County Executive Sam Page for his leadership, and I would hope the rest of the council members would follow these leads from professional healthcare officials that say we cannot take these aggressive steps backwards. St. Louis County NAACP has been around since 1909. We fight on every issue: healthcare, economics. We will not go by voodoo logic when we're putting people's lives at risk. So once again, thank you, St. Louis County Executive Sam Page. Please do not politicize this issue. It is costing Missourians their lives.
Thank you, John. In our nation right now, we see many who outright refuse to believe in science. And indeed, we have some on our county council who trust politics more than science. But I don't. I trust science. And I trust our public health experts to craft orders to protect our lives and to try and reduce the transmission of infections in our community. These bills, 222 and 223, entertain the false notion that our public health experts are driven by politics. And we should be motivated by politics instead of science when trying to determine how to protect the lives of everyone in our community. And these dangerous ideas that politicians are more reliable sources for public health decisions are taking our community in the wrong direction. In addition to being bad policy, bills number 222 and 223 violate Missouri state law and the St. Louis County Charter. Missouri law provides that the local public health authority, not the local legislative body, may take certain actions to prevent an outbreak of infections, contagious, communicable, or dangerous diseases. State law even makes it a crime for the Director of Health not to issue orders enforcing these laws. And therefore, the Director of Public Health not only has the legal authority, but also has the obligation to take necessary steps and to create necessary rules within state law to protect all of us and to limit the spread of COVID-19 in our community. The Director of Public Health has this authority, not the County Council, and thankfully so. The Director of Public Authority has used this rule, this law, to protect nearly 1 million residents of St. Louis County, despite immense political pressure provided by those who would try and provide political stunts instead of thoughtfully implement common sense public health safety measures. The Charter also authorizes the Public Health Director to ensure the effective enforcement of all best practices related to public health, to manage and control the treatment of diseases, and to respond to the epidemic and make sure that all the resources are available and all the programs are available to protect public health. Bills 222 and 223 would endanger the public health. It would cripple the Department of Public Health's ability to know how the pandemic is affecting everyone in our community, our residents, and would further contribute to healthcare disparities and vulnerabilities of many residents of St. Louis County. This bill strips protections for essential workers, it undermines the public's trust in public health, and it violates state law and the St. Louis County Charter. And that's why this morning I'm vetoing bills number 222 and 223. Downplaying the virus and questioning the decisions of public health officials is irresponsible and encourages irresponsible behavior. And I will not allow the health and safety of everyone in St. Louis County to be jeopardized by political shenanigans. Okay, I'm glad to answer any questions.
You talked a lot about ending the public health orders. Some of the people that are in favor of this bill have said it's about oversight. It's not about ending anything, whether that be the mask mandate or otherwise. So is your belief that if this were to become in effect, that those certain county council members would move to remove those health orders that are already put in place?
Well, I would encourage you to read the legislative language and not spend too much time focusing on what people say they mean for the bills to do. And I can tell you what the bills do. And what the bills do is it eliminates all the public health orders unless the county council, the legislative body, that's not empowered by state law and not empowered by the county charter, unless the county council decides to do something differently. And right now we haven't seen any legislation from the county council to do anything differently, and they don't have the authority under state law or the county charter to do it anyway. So I would encourage you to look at the legislative language and see what these bills actually do, and not what the folks that sponsored them say they meant for them to do, because they do something very differently, and it's very, very clear what these bills do. It's very dangerous to end these public health orders, to make public health orders a political football, and to stop the ability of the public health department to collect information about positive test results, to stop our ability to isolate people who have COVID-19, to stop our ability to quarantine, to stop our ability to monitor what's happening in nursing homes. These bills were not very well thought through, and they don't do what the proponents of these bills claim that they mean for them to do. The effect of these bills is very different, and it's very dangerous.
On another
Any questions?
topic, we've seen a lot of restrictions going back in place over in the Metro East. I know
Right.
we talked about at the beginning, our hospitalization numbers are going up, cases are going up. Anything on the horizon for us as it relates to St. Louis County when we talk about restrictions?
Well, I hope that the sacrifices we've made early on will protect us from further restrictions. St. Louis County is in much better shape than the rest of the state in many places in the country. The positivity rate is much higher in the Metro East, but ours is going up in St. Louis County, although we've made these tough decisions. We don't live in isolation. We do interact with other parts of the state and other parts of the country. But I do hope that we don't have to have any more restrictions, but hospitalizations are going up. We saw the hospital admissions number skyrocket last week. We've heard from Dr. Garza in the Pandemic Task Force that they're very concerned about hospital admissions. These are predominantly from other parts of the state, or at least in a large part from other parts of the state, where their hospitals have reached capacity because they made very different decisions in public health restrictions. Now, we're going to help take care of people from all over Missouri because that's what we do in St. Louis. We will continue to do that. But we have to recognize that our hospital capacity is being limited. Our healthcare workers are being stressed and stretched, and infections are starting to tick up in St. Louis County as well. We need to double down on watching our public health orders. We need to double down on masking, social distancing, limits of gatherings, and we need to take this seriously. If we follow our public health restrictions, if we follow our orders, if we follow our masking orders, then we will get through this. And I hope we can get through it without any further restrictions, but we're going to be watching these numbers very closely. Any other questions? Do you have anything, Doug?
I do want to get some photos afterwards.
Okay, great.
Thanks, everyone.
All right, thank you.